Hello everyone, myself I'm Dr. Prannoy George. So today I'm going to say a few words about IV cannulation. As you know, IV cannulation is an essential skill that every healthcare provider must know, which includes nurses, doctors and emergency technicians and even medical students. So it's a life-saving procedure and it is of vital importance in the ED. And so about IV cannulation, it is described in this cannulation catalog. IV cannulas are universally color coded. So it as you know that once you see that each cannula has its own color code. So it starts from a 26 gauge cannula, which would be preferred for a neonate or a small infant, and the flow rate in that cannula would be 13 milliliters per minute. And subsequently the next size would be a 24 gauge cannula, which is a yellow color coded cannula, which is again preferred for a small child, an infant, and the flow rate is again 13 to 15 ml per minute. And the next size would be a blue size cannula, which is a 22 gauge cannula, with the flow rate of which being 42 milliliters per minute. And subsequently, as we go up the size, the color also changes. The color of the next size would be a 20 gauge cannula, which is a pink color cannula. The flow rate of the cannula is 67 milliliters per minute. And the next size is a wide bore cannula, which we commonly use in the ED for resuscitative purposes, which is a green color cannula, which is a 18 gauge cannula, and the flow rate is around 100 milliliters per minute. And the next two cannulas are very large bore cannulas, which includes gray cannula, which is a 16 gauge cannula, and the flow rate is around 236 ml per minute. And the orange cannula, which is the largest available cannula, and it is 14 gauge, and the flow rate is around 270 milliliters per minute. So as the size of the cannula increases, as the size of the cannula, I mean, as the the gauge increases, the number of the gauge decreases, the flow rate increases. That is the essential point that we must understand. And all this is based on the principle of Poiseuille's equation, which states that flow across a cylindrical object is directly proportional to the internal diameter and inversely proportional to the length of the catheter. So that all the cannulas are based on that equation. And uh, for all resuscitative purposes, it is a standard guideline that we must achieve at least two large bore cannula. So what exactly is a large bore cannula? Large bore cannula is anything is 18 gauge or below. So below as in the number goes down but the size of the cannula increases. So green cannula, gray cannula or an orange cannula would encompass a large bore cannula. So for resuscitative purposes, such as in cardiac arrest or in severe hypovolemic shock or in a hemorrhagic shock, as in case of polytrauma, we would suggest we would recommend using a large bore cannula, two large bore cannulas in two different sites. And with that, I would like to end the presentation. Thank you.